But let's go into now what specific types of treatments you might seek out. So the first type we're going to talk about is psychotherapy, which broken down, therapy, that's psychological related, psych related, psychotherapy. So this is an interaction between a therapist and a patient, someone who is suffering from a psych problem. And the whole point of this is to provide either some sort of support or relief from whatever struggle that person is facing. I really enjoy this little cartoon depiction of it, where your brain might just be a hot mess. I've had days like this where you're just like everything feels like it's weighing down on you and it's all tangled together, and just getting to talk it out helps to kind of ravel up those knotted up strings. So they can help you make connections and unravel things in ways that you can't do yourself. And there are 3 different approaches that psychotherapy can take. The first is biological, but biological psychotherapy is a goal to focus on symptoms, treat symptoms that have underlying medical conditions. So the way that you might think about this, let's say you come to your doctor and you're experiencing a lot of tiredness, maybe you're losing weight without trying to, and you're like, something's up, like maybe I have depression, I don't know. So someone who is taking a biological approach would look for underlying medical conditions that might explain those symptoms first. So maybe this person has something like type 2 diabetes, and they're presenting with these symptoms that also cross into depression. So if you do testing and you discover that they have type 2 diabetes, you would treat the diabetes instead, which would then trickle down and treat the depression symptoms. So biological approach, focus on underlying medical symptoms first. In contrast, the psychological psychotherapy approach, which is the opposite. So this is treating behaviors, cognitions, thoughts. So this is treating the feelings that you're having, the thoughts that you're having, etc. Often comes in forms of like counseling, for instance. So this is focusing less on the biology and more on the symptoms that you're presenting with, as far as what kind of psych disorder they might match up with. And then lastly, sort of a combination of different things, we have what's called the evidence-based approach, which sounds like the thing that we should be all using. And it combines a bunch of different things. It doesn't just stick with one approach. You're asking yourself, what treatments are the most effective? What's current research say? Do I believe that research? Let's evaluate it. Let's integrate that knowledge with what the current patient is experiencing, and we'll keep evaluating how it's going and make adjustments as necessary. So this is a pretty popular and useful approach to psychotherapy. We talked earlier about how disorders develop. So one other approach is to take all of these into account. So the biopsychosocial approach combines those 3 things. It combines treatments that address underlying biological issues, they address personal issues, and they address social environmental factors that all might contribute to some psychological disorder. So different approaches that could be used with psychotherapy. However, none of them are quick fixes. It's not like you go to one therapist or you take one bout of medication and you're cured. So I'm going to show you a video down below of the actual APA describing psychotherapy.